Hello, everybody. Thank you for joining us today. For those of you that might not be familiar with the Opioid Project, the Opioid Project is an active working group of the Washtenaw Health Initiative that's committed to addressing the opioid crisis here locally in Washtenaw County. So through a collective impact model, the WHI Opioid Project is made up of a bunch of volunteer organizations across the SUD and mental health space here locally. And this is one of the first webinars that we are going to start doing as a part of our online educational series. So the nice part about these webinars is we're able to partner with local organizations and highlight real services that are available for the people that a lot of our organizations serve here. So for those, if there's anybody that wasn't able to make the webinar today, these will all be recorded and uploaded to our website, which I'll list for everybody here at the end of the webinar today. So again, welcome everybody. Our first webinar topic, as everybody probably has figured out, is harm reduction. We really wanted, the group decided that we really wanted to focus on harm reduction because of a lot of the effects that COVID-19 has brought to our community. So with the increased social isolation, switching to telehealth, kind of everything has just been changed overnight. And while we did see in the year leading up to COVID, that the overdose death rate had dropped for some populations, COVID-19 has seemed to have an effect in seeing that rate rise again. So with that, we decided that keeping people as safe as possible while they're using substances really should be a critical focus right now. And so with that, we were fortunate enough to be able to partner with Univide HIV Health and Beyond. They are a local agency that provides a syringe service exchange program, case management and counseling services to people who use drugs in Washtenaw County. And so through this webinar, we hope that once we leave today, everybody can kind of understand the types of harm reduction services that we have available in the county, highlight how these service providers are able to reduce the imbalance of power and engage within a supportive, non-stigmatizing approach. And then most importantly, how do we connect people with these services? How do you get in touch with Univide and get people connected to these resources? We would like to make this webinar interactive as possible. So either in the chat or the Q&A section of your screens, feel free to answer questions as we go along. I'll be keeping a lookout in those so we can get those questions to the panelists. But without further ado, I will let the panelists that are joining us here today go ahead and introduce themselves.
Hello, everyone. My name is Ashley Shukai. I go by she, her pronouns, and I am the harm reduction program manager.
Hello, everyone. My name is Tasha Ball. I am the clinical therapist at our Rigged Harm Reduction program at Univide.
Hi, everyone. I'm Nat. My pronouns are they, them, and I am the harm reduction case manager with Rigged Harm Reduction at Univide.
Again, thank you guys for joining us. Really helpful in kind of understanding a little bit more about what you guys do and how people can benefit from your services. So I guess we'll go ahead and start off. Ashley, if you could kind of frame this webinar a little bit and kind of talk about the importance of harm reduction and some of the basic principles that you guys operate with.
At its core, a social equity and racial justice philosophy to shift that power imbalance and the resources for people most impacted by structural violence. It's really rooted in queer, trans, Black, and Brown people who use drugs, their survival systems. And while we think of harm reduction as, these services and strategies, we have to, you know, understand that core foundation as public health caught on many years later after compelling evidence from HIV and hepatitis B outbreaks decades ago. Some basic principles for harm reduction include accepting that drug use is a natural part of life, acknowledging the harms and benefits of substance use, whether it's illicit or illicit, really being person-centered and not defining what they choose to put inside of their body or not, and that they're the experts in their own life, and that context is everything. So in other words, we're really talking about setting, place, mode of use, and why people are using substances the way they do.
Now, with the services that you provide, then, do all people that utilize your services have a substance use disorder?
No. So with the DSM-5, it lists very specific criteria for substance use disorder. And the majority of people, whether here in the US, throughout the world, would not actually meet that diagnostic criteria. What we know is about 70 to 90% of people who have used drugs in their lifetime would not meet that criteria. And it's critical to think about the substance dependence, right, as a medical term. And it's not the same as when we use the word addiction. So substance dependence and tolerance are expected physiological responses that occur with prolonged exposure to certain substances. And tolerance is when the body becomes accustomed to the presence of a substance and requires higher doses to achieve the same effect.
Okay. And so I think when some people think of harm reduction services, the extent of what they're imagining is like a syringe exchange program or something like that. How do the services that you provide wrap around the whole person outside of that aspect of just providing clean supplies?
Yeah, I think it's important for people to really understand that harm reduction services like syringe service programs are really a healthcare, right? And it's mental, physical, and comprehensive, and that nothing works in a vacuum. So if an individual comes in for public health equipment such as syringes, that we know that their physical health will improve as rates of skin and soft tissue infections, bloodborne bacteria, which can lead to heart valves and endocarditis, that those cases are rising, and we want to make sure that we're providing them to be physically healthy for the now and for the future. Many times, you know, we're talking to individuals and testing for hepatitis C and HIV, and then also providing that information so that we can reduce their risk of acquiring that as well as spreading it throughout the community. We're having that safe space, and many times, you know, when we start talking to individuals, their focus is not the substance use itself causing the harms, but the barriers to housing, healthcare, and other services. Nat, do you want to?
Yeah. So as a case manager, a big part of the work that I do revolves around helping people ensure that their basic physiological and safety needs are met. I think ultimately people can't address their chaotic substance use until they can address the underlying internal causes of their use. And they can't feasibly do that until their basic needs like food and housing are met.
Thank you. So I think acceptance and embracing of the harm reduction model has definitely grown, especially in recent years, kind of amongst what you would call the substance use disorder community. How, you know, oftentimes a lot of these programs from a public perspective are not necessarily viewed in the right light just because of the lack of education and things like that. How would the average person kind of reconcile their belief that harm reduction services are enabling and kind of create barriers to treatment?
And I think that's probably one of the most common misconceptions, right? And we want to think of, we go to treatment, we have a quick 90 days, and at some point we're going to get better, right? But many times when individuals have a substance use disorder, they occurred that trauma and processing over many years, right? And we can't expect trauma that's been endured and the stigma, that really breaks people down to go away so quickly. It occurred, it took a long time for people when we think about ACEs and, looking at the childhood traumas, we can't erase that overnight. And so sometimes with our services, we may have individuals coming in that have chaotic use. And it may be, 3 to 5 years before they even reduce that use. But we're really looking at the longer term goal of keeping people healthy, keeping them alive, and finding ways that, we can take that and provide that support where we're making them feel like a whole person and giving them that empowerment and confidence to, address their core needs.
Kind of also in recent years, there's been, some increased funding in funding outreach efforts, especially in urban areas. Can you talk about what outreach looks like when you're coming from a harm reduction perspective?
Yeah, the best way, to really think about outreach, whether it's harm reduction services specifically, like handing out naloxone or handing out syringes, it's who is that community, right? And what is your relationship to that community? And are you a part of that, right? We don't want to step on anybody's toes, and we want to make sure that we're giving control and decision making to that community. For example, one of our outreach individuals was previously houseless, and he was already a part of a encampment. And so we knew that nobody should be going in there but him that already had that relationship, with that group. I wouldn't want to go in there and say, hey, here's some supplies, let me know, because it's invading that space. And so when we have outreach, we want to make sure that what does the community want? What does that area population, what is accepted, right? And having that nothing about us without us, and making sure that we're empowering that group that we're doing outreach with.
Awesome. Thank you. Now, kind of moving into, I want to take some time to talk a little bit about the different services that Univide provides. So Ashley, do you want to kind of start off by talking about the mobile syringe service program?
Yeah, so this program started in about 2000. Our famous OG Lamont Gore started in 2001, and he has been providing services now for 20 years. That's how I originally met Lamont when I was an adolescent, who, kind of met all these different criterias. And so our van goes to different locations, and we get to sit, hang out with individuals, figure out what are their needs. We provide HIV, hepatitis C testing, counseling services with them. A lot of times it's providing just that compassion and support. And we provide, whatever public health equipment that they need at the time. Sometimes it's providing them food or providing them connections to housing or treatment if they want that. It's really just that human connection, and having this old van drive around, and people kind of reminiscing about it.
Awesome. Yeah, we have a video here, so I can go ahead and show that if you want to walk people through the van and kind of what people see when they come out.
Yeah, so you'll see our hoopty. I was trying to walk there the other day, like put a video together, it was not working so well, but this is pre-COVID, right, of what we're able to do. If people wanted to come inside, a lot of times we place all the supplies outside. So I want to be real with that. But we'll have food. Somebody gave us some shoes, different supplies. And then we sit down, we'll say what's going on. Maybe they want some education about safer drug use. We can provide that, go over the supplies. Sometimes it's just about, hey, I'm mixing these substances, and it's us talking about, like right now, xylazine and other adulterants in the supply, and they're learning about fentanyl test strips and what does it test, what does it not test, and how we can move forward to keep them safe. A lot of times, they're showing us wounds and so pieces that really need to be addressed by healthcare professionals. And so we try to partner with Wolverine Street Team and having physicians come out when they can, because a lot of times they've been beaten down so much that they think they deserve to have these wounds and abscesses that essentially are going to end up in the ER. And so our van, provides a safe space, but going into the community where it's needed most. We also have some other services that we've recently added on because we've seen a lot of requests for case management and a specific type of substance use management called harm reduction therapy. And I'll let Nat and Tasha describe that more.
Thank you. So let me pause real quick. Did anybody in the audience have any questions about the mobile SSP or any of that aspect of what Ashley just talked about? All right, we can go ahead and move on then. We're going to go ahead and kind of move on into Nat's area of expertise and put together a little video here that kind of goes over some of the harm reduction case management.
Hi, my name is Nat Dodd, and I am the Harm Reduction Case Manager with Riggs Harm Reduction at Univide HIV Health and Beyond in Ypsilanti, Michigan. As a case manager, I can assist individuals by providing them with information, resources, referrals, and direct assistance in order to help them fulfill their needs and meet their goals. I help folks access things like housing, employment, education, healthcare, legal assistance, mental health treatment, and more. As a practitioner of harm reduction, I feel it is of the utmost importance that people establish their own goals. Everything I do with an individual is based on what feels true for them. This means I embrace each individual and all of their complexities and never pressure folks into doing anything that they don't actively want to do, including treatment for substance use or pursuing abstinence from drugs. It also means that I don't labor under the delusion that I, as the social worker, somehow know what's best for the individual. Instead, I work to establish a relationship wherein the individual and I can become collaborative partners in fighting through a system wrought with discrimination and inequities in order to meet their needs and achieve their goals. If you or anyone you know is interested in harm reduction case management services, please feel free to give me a call at 734-496-0307.
Okay. It looks like we had a question from the audience wanting to know, do we help clients post-prison? So I'm guessing post-release from prison?
Yeah, so many of our individuals, have had some type of criminal legal system involvement. And the harder part is we can have individuals come in all day and help them with services. Right now, though, with the criminal legal system, to ensure kind of mandated requirements, right, within their probationary periods. We don't have that response from the courts yet. And that's something we're trying to address to make sure that we're a valid service to help promote healing and moving forward in their requirements.
Thank you. And there was another question as well regarding the schedule of the van and where it'll be located on dates and times. That Ashley can get to me, and I will provide that to everybody after the webinar here. And then somebody else wanted to know, do you guys provide naloxone training or equipment?
Yes.
Yeah, and there's a number of different organizations around Washtenaw County that do that as well. There's another question here. Can people reach out if they have been, even if they have been in prison?
Yes.
Or is it only court guided?
Either or. We currently are working with a probation officer that just kind of happened this week that we're trying to figure out, and trying to see how we can work with the individual that's currently incarcerated to get them services.
Thank you. All right, so everybody saw that video kind of giving an overview of HR or of harm reduction case management services. Nat, was there anything else that you kind of wanted to add about what you do?
Not that I can think of at this present moment.
Okay. So how do people typically get enrolled in case management services? Are there any, requirements, referrals or assessments or anything that need to be done?
Yeah, so we keep our requirements pretty low because we want anyone who is interested in our services to be able to access them. So right now the criteria for our behavioral health services, and this applies to both my case management services and Tasha's therapy services, is the individual has to be at least 13 years old. Individual has to either be living or staying in Washtenaw County. And then the individual has to have either current substance use or a history of substance use. And there's, a couple different ways that people can get referred. We do have a referral form, which we can provide to you, Matt, that you can send out to folks after the meeting. If providers want to complete the referral form, if you have a specific client that might be interested, and then just email it to either myself or Tasha. Or alternatively, you can always reach out by phone, or the individual looking for services can reach out by phone to set up an intake appointment. And, once we set up the intake appointment, we either Tasha or I meet with them and we complete, the required assessments and develop an individualized service plan to initiate their treatment.
Awesome. Now, can people get connected to these services while utilizing the mobile van?
Absolutely. Yep. So I know the folks who run our mobile unit do have our referral information, and they're always happy to refer folks that use the syringe exchange services.
Awesome, thank you. So we're gonna go ahead and unless there's any questions, does anybody have any questions about the case management services? All right. Well, then we're gonna go ahead and move into the harm reduction clinical therapy. Again, we got a quick video to show you here.
Hello, my name is Tasha Ball, and I am the clinical therapist with Riggs Harm Reduction at Univide HIV Health and Beyond. As a therapist, I work with individuals whose goals may be related to their mental health, their substance use, and just their general well-being. I work with individuals who are seeking substance use management as well as treatment for co-occurring disorders. And as a clinician, my first priority is always the safety and comfortability of my clients. I seek to provide them with a welcoming space free of shame and judgment, and folks are encouraged to come as they are and work through their goals at their own pace. So, harm reduction therapy seeks any positive change and prioritizes individuals' safety while allowing them to be in control of their treatment. So only an individual knows what's best for them. I don't try to be an expert in anyone else's life. I am there to provide support and tools for clients' self-identified goals. I also realize that individuals may use substances for various reasons, and substances can be helpful in many different ways. Harm reduction therapy does not force abstinence, but rather identifies a way in which individuals can use safely. So when meeting with a client, I take the time to, get to know them, do an intake with them and get a better understanding of their experiences, because everyone has had different experiences, and that can help me start to build a better relationship with the client. I work at folks' own pace. I don't push for information they're uncomfortable sharing. The client has full control over what we work on during our sessions. I'm just there to help them reach their goals, whether that is reduced use, increasing the safety of when they're using, or abstinence. The client and I work together to find an approach that works for them and can help address their individual concerns and challenges. If you have any questions or you are interested in these services, please give me a call at 734-787-4732.
All right. Thanks, Tasha. Was there anything else that you wanted to add or go into more detail about for the clinical services?
Yeah, I think one big thing for me that I like to talk to folks about is that in general, the idea of therapy and the idea of, what social workers do is that, everyone should be working from that harm reduction standpoint, right? Of meeting folks where they're at. As a profession, social workers, as Nat pointed out as well, are not in the business of telling folks what is right and what is wrong for them. That goes against our code of ethics. We have to, identify that the person that we're working with is, they're in control of their own life and they know themselves best. So whatever it is that they're telling me that they need, we're gonna help them work toward that and in whatever capacity makes sense for them. So I just think it's important, for folks to know that like this space is safe. And I think that can be hard for some people who have maybe had negative experiences, with any type of service. So I think there could be some hesitancy, but, just trying to convey to folks that, we really are just here to be with you and, come as you are. And there's no judgment. We're here to do what it is that you feel is best for yourself.
Thank you. Did anybody have any questions about the therapy component of Unified services? All right. I know we had a question about case management. Somebody asked if case management was similar to CMH or community mental health case management. Do people ever have both case management from CMH and Univide, or Univide and maybe another provider?
Yeah, so I haven't yet encountered that, but I could definitely, I think that would definitely be fine if somebody was receiving case management from both Univide and another provider. I think the kind of case management I do, again, is very harm reduction focused, and you know, I might do it differently than other providers. So I can see that it might be beneficial for some folks to be seeing me while they're seeing like a CMH case manager as well.
Thank you. Had another question on the therapy side. Does the harm reduction therapy also address things like trauma, or is the focus only on the harm reduction aspect?
Yeah, so thank you for asking that. A big part of harm reduction therapy is trauma focused, because I think this question kind of relates back to the part of, well, how do we talk to people about concerns with enabling. The biggest question that we can ask ourselves as someone who has another person in front of them is not what's wrong with you, but what's happened to you, right? Like, what are those experiences that you've had? What is the reason behind the substance use? Like, is it more times than not, right? It's providing a purpose. So that purpose can be very positive for the client. So it's not something that we want to just rip away from them, because that could be a coping mechanism for them because of the trauma that they've suffered. So it's really important to dive through all of those things and to really understand the person, as the person, and not just as someone who uses substances. That's not all they are. That's not who they are. There's much more, to the folks that we're interacting with and trying to connect with. So yes, definitely trauma is a huge part of harm reduction therapy. And harm reduction therapy doesn't have to be necessarily immensely different from the idea of, if someone just says, yeah, I'm in therapy, or this person provides therapy, right? Like, we're just, that extra component of harm reduction is, that understanding and not pushing abstinence, meeting them where they're at, and then focusing on safety in all aspects of the person's life, not just necessarily their substance use.
Yeah, so a lot of what you're saying is it's your very, I don't want to say standard, but it's very much what you would expect if you sought therapy on your own. Just has that qualifier in front of it that, you are kind of a safe space to, discuss substance use in a judgment-free, non-pressuring, environment.
Yes, basically, yes, in a nutshell.
Yeah. Thank you. Any other questions about these services or anything that we've talked about so far? Awesome. I know that everybody's kind of, or the panelists have kind of touched on this in terms of getting connected, but I just wanted to be sure that everybody's clear about this. We are going to be sending out these materials as well to everybody who's registered for the webinar today. But if you're a provider in the community, you are able to make referrals directly to Univide, and they have a PDF referral form that I have put in the chat. Again, I'm going to be sending that out. Participants can also get connected via the mobile outreach van at the dates and times that were put in the chat as well. And I'll also, include that in the information that I send out. And then again, the criteria for service were over 13 or 13 and over?
13 and over.
So 13 years and older, lives or stays in Washtenaw County, and is using substances.
Currently, or a history of substance use. Yep.
So, compared to a lot of other services around the community, very low barrier, and it sounds like a place where people can get help pretty quickly. And so for the last part of this webinar, wanted to take a minute to touch on the legal implications for people that for people that access these services. We know a lot of local jurisdictions have local policies that criminalize the possession and use of whatever is to be considered paraphernalia, which usually has kind of wide range of definitions that can be interpreted very loosely. So Ashley, I was kind of wondering if you could give us kind of just where we're at in Washtenaw County. Are our local law enforcement agencies working with you guys to make sure that participants aren't encountering legal trouble for paraphernalia charges? Are there law enforcement agencies that aren't very good with that? And then I guess more policy focused, what's kind of currently being done to address those concerns?
So I would first say, with the state of Michigan, we've had this established for a long time that whenever we have someone that comes in to enroll and engage with our syringe service program, they're given a card. So we register them with some basic info that we won't have, identifying information on. And the card is issued to participants that are obtaining public health supplies. In this card, it discusses the NCL code that demonstrates that they're exempt classification for drug paraphernalia, right? And that it's an object sold, offered for sale, or given away by state or local governmental agencies or by a person specifically authorized by state or local government agencies to prevent the transmission of infectious agents. And the reason I say that is it's a really important piece that in the state of Michigan, the paraphernalia piece would not be illegal, okay? And we try to make sure that participants always have this card on them. However, the Michigan law, has some loopholes in there for local townships, cities, and other municipalities. In Washtenaw County, we have Ellie Sevy, and he's been phenomenal on really making a health focus instead of a criminalization one for many individuals that engage in substance use and sex work, and really trying to make things equitable and just for healing. With that, though, we do have local ordinances within Washtenaw County that paraphernalia is illegal. And we, try to make sure everybody understands. We've been having engagement conversations for decades now with law enforcement. Many, really want to help and not criminalize individuals, but then at the same time, we have to understand the racial disparities within the county and the harms that are also associated with just substance use in general. So we do have local municipalities in Washtenaw County that, do arrest individuals for paraphernalia, even if they do not have a personal supply on them. And it's an issue. I'm not going to name, names, because I think as part of the healing process and accountability piece that they need to be here also to listen to the harms that causes, especially amongst housing and regards for individuals who are parenting. With this, though, our participants, a lot of times, they're scared, or they're resharing, or they're reusing equipment because they maybe don't have access to sterile supplies or can't come out to us. And so these laws heavily dictate what their behaviors are going to be, for the fear of criminalization and losing out on so much, in life. With this moving forward, though, we are trying to have more conversations. We are also engaging in a overdose prevention coalition in the state of Michigan, because this is a common issue that all syringe service programs have. And we're trying to help provide some subject expertise so that when things are approached to legislatures, that they have an understanding that these are real people and real consequences for what is a health issue and shouldn't be a criminalized one.
Thank you. If anybody or different organizations were interested in getting more involved in the advocacy aspect in changing some of the legislation at a local or state level, what's a good way to go about doing that or getting in touch with?
I think really showing your support and support letters, publicly acknowledging that harm reduction is evidence-based and it's not a moral failing for people using substances is a huge piece on a community and grassroots level, right? Like we need that support to help move things forward. Another thing would be writing support letters to their representatives. A lot of times that's not even a discussion to representatives. They just hear that so many of us are dying, right? And they don't think about all the extra pieces that could go in and help support individuals. And if they really are, if you're really interested in like the advocacy efforts, any individual can always reach out to WHI, reach out to me at Univide, and I'll forward you information to this Michigan Overdose Prevention Coalition, because we really need all the help that we can get to keep people alive during this time.
Thank you. So with that, that is all the information that we had to present today. Wanted to open it up to see if anybody in the audience here had any additional questions before we wrapped up. All right. Well, if there aren't any other questions, I'm going to leave the room open here for a minute, so feel free. Again, I want to thank everybody for joining us. If you're not familiar with the Opioid Project, you can learn more on our website. That is whiopioidproject.org. Copy of this webinar will be posted online as well. And if anybody had any other specific questions or were interested in joining the Opioid Project, we meet once a month. Feel free to reach out to myself, and my contact information is up on the screen. But thank you, everybody. Hope to see everybody at our next webinar.